I would say that this has been the year of the resilient health system. In order for health systems, particularly large health systems, to be able to really meet the scale and efficiency demands, they have to really revisit their operations.
Overall, I would say COVID just challenged our assumptions around things within our operations, how we had structured them, and caused us to look again at how we might approach for the next kind of horizon of improving our performance. It also amplified gaps that we had.
We knew we had problems. We know every day we have issues, throughput and transitions of care, but it really shined a light on a lot of inefficiencies that we know we need to fix moving forward. Better throughput, better length of stay. The hospitals still create the margin. And so, we have to continue to optimize that so we can pay for all the things that we need for our communities and continue to offer care to as many people as possible.
We have areas for improvement around our mortality, our patient engagement, and length of stay. And oh, by the way, we're still living in a pandemic, which challenges our efficiencies on an everyday basis.
We've been looking at the stress and the strain on our healthcare workers, on all our frontline people. Giving them the gift of spending more time to manage and care for patients will help us in many ways. It helps all of us connect with why we chose healthcare. It helps us all connect to improving the experience for a patient. And it also, I think, provides time for people to become a team and really relish in that environment and flourish as professionals.
No nonsense from a physician point of view. It makes the easy stuff easy. The patients who should be on autopilot and are medically simple and should just slide out the door because we work like a team, they do. Doing that allows us to then focus more of our time on direct patient care, managing more complex cases, and it helps us triage our priorities. We're very aware of alert fatigue. We're very aware that nurses and doctors are pulled in way too many directions already. We use Qventus to help orient them to, where's a win that they can get during their day, or help connect them in ways that they might not have known.
For those that are familiar with Epic and other EMRs, it moves data around internally very well. It does not do the last mile question of getting data to the user unless the user goes to pull data.
I've used discharge dashboards, discharge spreadsheets, discharge Pareto charts, and a mountain of Epic reports. And as a physician, Qventus has given me a real-time playbook that contains the most important information around every patient's flow.
Some of the work that New York Presbyterian and Qventus did early on was not about the technology side of innovation, although we were really happy for the AI and the machine learning that you all brought to us. But you were good partners in learning our clinical operations and establishing standardized baselines that we just never had before.
But this behavioral science piece, to hardwire change, to me is probably one of the most forgotten pieces in change management and really making any improvement. So I think that's something that we're really trying to hardwire and understand change behavior, change management skill set in our leaders.
The future favors the bold. And I think there is a aggressive leaning in to doing things that they would have considered unlikely in the past.
When we started partnering with Qventus, but it was also to sort of bring real-time data in and actually think about how we are managing and coordinating our teams across the organization to be delivering kind of as efficient a process as we can around every patient.
I think it's really important what Qventus is doing, and it takes the intelligence that our doctors and nurses have and put it into replicable practice. I think 40 years from now, we're going to look back and find it funny that doctors and nurses used to do a lot of things on their own and weren't merely making smart decisions from more of a command center. I think we're in that transition period, and then Qventus is helping us automate a lot of those functions.
We want to work smarter. We want to use technology and analytics to actually be able to predict where our patients should go or where we're going to have increases in volume.
I grew up with the no margin, no mission kind of motto. I really prefer to flip that around and say, no mission, no margin. And I say that because my mission, amongst the many missions we have here at UAMS, is really centered around flow. And in preparation for this presentation, I found there was a quote from Don Berwick. He says that flow is every bit as consequential for the health of our systems and the well-being of our patients, and deserves the same strategic prioritization as safety. And I think that's what we're talking about here.